Afternoon, everyone. Welcome to Medical Grand Rounds. Before we start, I'd like to make a brief land acknowledgement. McGill University is on land which has long served as a site of meeting and exchange amongst Indigenous peoples. We acknowledge and thank the diverse Indigenous peoples whose presence marks this territory on which people of the world now gather. Thanks, everyone, for being here today. Just a brief reminder to please enter your questions in the chat at the end of the presentation, and please answer a brief survey that will be sent to you immediately after the presentation. This will let us know that you were present at today's rounds. It's a great pleasure to introduce one of our colleagues, Dr. Sara Ahmed. Dr. Ahmed is a physiotherapist and Ph.D. She's a professor in the Faculty of Medicine and Health Sciences at McGill University and a senior scientist at the RI-MUHC and the Centre de Recherche Interdisciplinaire en Réadaptation CRIR. She leads a research program in person-centered digital health research and is the scientific director of the brilliant Learning Health Community Project, which is part of a network of international living labs and open science initiatives. Dr. Ahmed conducts research aimed at improving health outcomes for individuals with chronic diseases. Her research addresses the implementation of digital health solutions and patient-centered outcomes across trajectories of care to inform clinical and health systems decision-making. She's an advisor for the implementation of the patient-centered outcomes for Quebec Support Unit and the scientific director of the FRQS Digital Health Network. She will share the planned objectives and activities of the network that aims to advance the training of the next generation of digital health scientists and innovators and accelerate the development, implementation, and evaluation of digital health solutions. Thank you so much for being here today, and we look forward to your lecture.
Thank you so much for that comprehensive introduction. So I'm going to share my slides. So thank you, and thank you for the opportunity to come and share with you a lot of the thinking that we've been doing around how do we build capacity in digital health. We've reached a point right now where we recognize the critical role and probably the necessity that for having technology within our healthcare system if we're truly going to address a lot of the large challenges around access to equitable care, improving quality of care, and improving population health. We know that we are facing a lot of challenges around making digital health a reality within the healthcare system, and not so much around the technologies themselves, because those have really flourished over the past several years, and we've certainly seen that after COVID. But many of the challenges are often from some of the downstream issues around being able to generate evidence to recommend the use of these technologies in real-world settings and going beyond sort of the endless pilot projects, but also around adoption within the healthcare system and really thinking about end-user needs and preferences to help ensure a successful use of these technologies, whether it's for improving efficiencies within care or improving or changing behaviors in order to improve outcomes. And so today I'm going to share with you a little bit some of our thinking about how we could closer to home work together in order to build capacity to address some of these challenges. But to start, I'll go through a bit of a background and look at a very high level around trends in digital health, explore a little bit more of these challenges, but really what I'd like to spend more time sharing with you today is the Quebec network and how you can become involved in that. Just to set the stage, we know that we're having a shortage of workforce at a time where the needs are expanding exponentially. And at the same time, we're really trying to transform the traditional patient-provider relationship and move towards a much more collaborative model, which we know is really important for having the individual take care of their individuals and the population take care of their health for the majority of the time when they're not in touch with the healthcare system and for healthy aging. We're also recognizing and seeing a transformation with technology, allowing us to take care more out into the community and hospital at home, and leaving the more expensive in-hospital services for those who really need it. And at the same time, with this explosion of technological solutions and the ability to capture data more readily, understand how could we make use of that data in a meaningful way to support decision-making and integrate it into everyday workflow for getting to the vision of a learning health system, how we learn from everyday encounters and information that's available in order to improve individual as well as program or population level care. I'm just going to start with, what do we mean by digital health? And so it's an area where we're referring to the development and use of technologies, and this is telehealth, diagnostic tools, very wide range of tools to strengthen the health system by maximizing or harnessing the daily use of these digital technologies. We see that there's a readiness for this by the public and the population, where even among older adults, where typically there's been this perception that they'll have the greatest challenges in adopting technology, where 84% of them say they are willing to use technology, and 90% actually would like to use technology in order to monitor their health. That's the desire, but what is actually happening is, in the most recent Digital Health Services survey, what we see in terms of Canadians using technology, the majority of those among an adult representative sample across Canada are using it mainly with family doctors to see specialists and other health professionals. So that's where they're receiving it. What are they using it for? We see that it's still heavy on the administrative side, which is great, because we know that from the administrative aspects, if the population can get medical advice, make appointments, receive information, then that helps free up some of the resources and helps improve efficiencies and experience with care. But it just means that we are not maximizing the use of technology yet for the more advanced health-related lifestyle behavior type of interventions, where we know technology can have a great impact. Zooming out and looking at the larger landscape of technology, and Bertalan Mesko is a medical futurist, is what he refers to himself, but he has a team of data analysts who are often tracking and looking and seeing what's the landscape of technologies. And they publish every once in a while sort of the top 100 companies that they do not receive any support from. So it's supposed to be an independent view. But what you see here is the potential of technology to really disrupt and transform different areas of healthcare that are still not realized in terms of scale and spread at a high level at this right now. So this ranges from health management, if you look at the bigger bubbles, to lifestyle management and digital health, diagnostics, of course. We've seen great trials recently, and the use of AI in general for decision making. Remote care, which we saw exploding during the COVID pandemic. And then areas that I've worked more closely with around virtual reality in order to increase access and intensity of care and improve mental health outcomes for different patient populations is also expanding. But this gives you an idea of the breadth and the possibilities of where technology can take us in order to address some of the larger challenges throughout healthcare. With the increase in the number of technologies also comes the complexity of actually selecting and implementing them so that we see their effects trickle down into clinical care and uptake in clinical care. And with the creation of the FDA Digital Health Center of Excellence to provide some regulatory guidance around the use of technologies has been extremely sentinel in helping understand and make sense of the different technologies and have sort of good sense use and safe use of these technologies in clinical practice. We have the equivalent of the FDA created now in Canada through Health Canada. And for example, together, these bodies come out with recommendations for good, for example, use of AI for medical device development and testing, which you see here. And then they, of course, they have regulatory standards around which types of softwares, which types of applications require regulatory approval and up to what level, depending on their risk to the population and their purpose and use within clinical care. So these regulatory bodies are really helping to have safe application of these technologies within the healthcare system. But where we're having challenges around rigorous and rapid generation of evidence for equitable application of these is generating the evidence itself in order for these technologies to make it into clinical practice is quite challenging. If you caught Dr. Nancy Mayo's presentation on complex interventions, most interventions for digital health are complex and have many key ingredients. And so running trials, picking the right control group, and being able to test them on a large scale is quite challenging. And when new technologies are put out there, the way that they're tested is quite variable. Some of the messaging could be quite misleading. So as an end user, trying to pick the right one for a practice could be difficult. And in general, most reviews that are out there in specific technology areas and for specific patient populations show quite a lot of variability in the evidence that's available. The great news is that there's a lot of work done around creating frameworks to guide large-scale trials more recently, recognizing this complexity. Adoption, I've already mentioned, is quite a challenge with the number of options and limited clinical implementation on a large scale in testing. And this is where the importance of using, taking some of the tools and the approaches of trying to co-develop and create and implement these technologies in world settings and not waiting until the technology is available and then trying to implement it can help accelerate end user adoption. And then, of course, what's really important is thinking about equitable access. And while technology plays an important role in getting access to more vulnerable populations, like, for example, those in rural communities or those who would otherwise not be able to access the care, we also know that technology can make the divide even greater if there's limited internet access and not thinking about social determinants of health. And in fact, one of the suggestions is that digital health literacy and the internet be considered one of the social determinants of health when we're looking at disparities in healthcare. Going a little bit more in depth to give you a specific example about a framework. This is more recently proposed by Silberman and colleagues, where they really say, what steps do we need to take to go from generating the evidence to thinking about actual clinical applications so that there could be rapid advice that's given to different groups, including clinical settings, different insurance companies that are thinking about coverage, clinicians, patients themselves in selecting these, is they propose this 4-step approach, which really is the same steps that we go through in generating evidence for a new intervention, which is, first of all, in digital health, just making sure it meets the security and safety regulations. And step 2, thinking about an established approach of evaluating quality of those studies like we normally do in scientific evidence, for example, the GRADE framework, and saying, is it a rigorously tested trial and well-developed trial? And then they add other criteria, which is the defined supplement checklist that looks at different areas for considering application in digital health that has to do a lot around application in a specific population, end user requirements, and whether those were thought through. And then putting all that together to come up with actionable recommendations, whether a technology is ready for use in a clinical setting and in what way it should be or not used. Just to zoom into a little bit more in terms of the criteria, it is a socio-technical framework that was developed by Jacob and colleagues. I had participated in the Delphi for this, where they were trying to pick criteria to reflect each of the social, organizational, and technical requirements for an e-health tool to be ready for implementation in clinical practice. So you could see just around the circle the different types of domains that they're thinking about, but also the complexity of what needs to be considered at different levels of the technology, the system level development, but also the sustainability of a technology tool for it to be ready to be scaled up. And that gives us a sense of sort of all the moving pieces that have to be considered, and why it's so complex to develop and test these different types of solutions. Coming a little bit closer to home, I'm going to share with you our experiences in our groups with testing different technologies and the steps that we've followed, the challenges that we faced, some of them that I've already referred to, and then sort of working together to have collective solutions to those challenges, recognizing that other groups are similarly going through that close to home, and how we can work together in order to accelerate trials for testing digital health interventions, but also uptake in clinical care. So typically, when we're working with our clinical partners to look and see sort of how are we going to develop these technologies, is the first question is, what problem are we trying to address? So the typical 4 steps, and these are very iterative, and depending on the context and the solution that the technology solution we're looking at, it might vary a little. But I'm giving you an example here where we're working with clinical teams around acquired brain injury to sort of say, how could we improve trajectories of care for individuals, where we've identified 5 or 6 gaps that patients and families have said they struggle with when they're going through these trajectories of care, basing it on the evidence and already what we know, what can possibly help, going through co-creation sessions with patients. Typically, it's interviews, especially if we want an equitable representative sample of the population, because they always tell us they're more comfortable one-on-one discussing some of their thoughts around what could help them improve their experience within the healthcare system. And then we'll go through with different clinical groups to sort of look at what the range of options of technology solutions and functionalities within those are, and prioritize, because often the list is too long and too complex and might not have high impact relative to the resources that are needed for those solutions. I just want to say also that if one of the questions we always ask is, does it exist? And if it does, let's not reinvent the wheel and recreate it. So we often work with industry partners to plug in to parts of the solution that they might already have. And then we co-design, implement, and test it. And we try to test it as much as possible within the clinical settings, and have a full implementation science evaluation as well, so that we understand what works, why, and what some of the challenges were to have iterative improvements in those technology solutions. So just to give you an idea of what those technologies are is, so again, we start in the literature. We know that virtual reality compared to usual care has shown substantial improvements in functional ability and longer term outcomes around cognitive function. And so one of the questions that we wanted to answer is how virtual reality can be integrated into the stroke trajectory of care, with the goal, our primary outcome, based on what's important to the clinical programs, and what objective we have is improving intensity of rehabilitation. So, for example, often patients are on the ward, and the time they can spend one-on-one with a physical or occupational therapist might be limited, or a nurse who could help with some of the rehabilitation that has to happen. And so virtual reality provides an opportunity for patients to practice some of those activities on their own while they're in bed, even if it's sort of somebody who's of lower level of function. And then the great thing is that as they go through the trajectory, virtual reality has become an accessible technology now where they could continue to receive that intervention in rehabilitation and then at home once they return back. So we have a trial going on to test that, not because there's not evidence that it works. We know that in a sort of an efficacy studies, that there are improvements in outcomes, but it's to say, can we gain that effectiveness and improvements in outcomes if we implement it in the real world around trajectories of care, and what would that look like, and be able to develop that clinical pathway of integrating the technology. In terms of the integrated care platform, we're also looking at software solutions that help with different challenges that are identified by teams as they're trying to transition patients from one level of the continuum to the next. So, for example, just matching a patient to the right service. Can they go into the early supported discharge program back home sooner and be discharged from hospital sooner? And readily having standardized measures with real-time scoring to make those decisions can help improve efficiencies in getting patients to the right place at the right time within that continuum. And so we've defined different modules that would help address some of the challenges identified by teams and patients. This box has different names of solutions that we are testing in different trials, and then thinking through how do they work, why do they work, but ultimately having wanting to improve the outcome of improving rehabilitation intensity. So that's just an example of the work that we've been doing. And some of the challenges is the design. So the design is complex. We often have to put a lot of thinking into how do we do the most rigorous types of trials that will actually be realistic within settings. If you have a practice change, to do randomized controlled trials at the individual level is very difficult. So we move to cluster trials. But then there often even that is difficult in terms of thinking through the different steps and measuring the outcomes at the right time in order to be able to see the effects. So we're often thinking about how do we tailor these trials in an innovative way in order to actually reflect the reality and still help ensure that we minimize the biases from the way that we're collecting and interpreting the data. Other challenges just around having capacity for the right types of professionals that we need from a project management, business analyst to collect the requirements and work with us through the different steps. Security issues, we're often having to work with the health regions to understand what the requirements are. Data sharing, so if data is going from an application and being stored in one place or another, management and analysis of that data. I talked about using different systems, so can the systems talk to each other and the interoperability? And of course, everything around ethics, consent, and recruitment. So there are a lot of complexities that all of us who are doing this type of digital health research go through. And so one of the questions we asked is, well, it would be great to get together and understand the landscape of who's doing what type of digital health work across McGill, across the RI, and across Quebec at large, and look for collective solutions that might help accelerate and maximize the resources that we have to develop, implement, and test digital health solutions. Close to home, we already have tremendous amount of resources. So there's the CLIP and Innovation Hub. We have 2 now degrees for digital health training. Of course, and I'll talk a little bit more about a symposium we did in 2022 that Dr. Tamblin really spearheaded in order for us to bring everyone together across McGill to talk about what work is being done and what needs to be done in order for us to really scale up and strengthen digital health research at McGill. There's also the different roles that have really helped strengthen and will help us move forward in terms of strengthening digital health at the MUHC and the RI. And then, of course, the CIUS Centre-Ouest de Montréal have really been spearheading a lot of initiatives in digital health, including the creation of the Innovation Hub Orots that really helps to bridge between industry and clinical practice in order to integrate technologies and evaluate them that are addressing problems that the programs have identified and helping accelerate the scale up of those technologies within the healthcare system. So this digital symposium that we had, it actually was in 2021, not in 2022. It started in sort of mid-COVID time. Over 3 days, we had deliberations with about 85 participants that represented clinicians, researchers, patient partners, and leaders in the digital health area. Just across the MUHC and McGill, 27 digital health innovations of different clinicians and researchers doing pretty amazing stuff was presented, and we asked them specifically to reflect on the challenges and some of the solutions they've used in areas in doing this type of work. And we came up with 8 themes that I'll share with you shortly. I guess the best thing of those 3 days is everyone had the same feeling and commitment that, yes, if we work together and we try to share resources, we can probably go much further than everyone continuing to work alone, and really commitment around how do we scale testing and development of digital health solutions. And this is just to showcase some of the great innovations that have been tested or are underway in being tested across the RI. In terms of the challenges that were identified throughout those days, and I don't think this is surprising to anyone, but it's data access and harmonization, and being able to have innovation for trials in the sense of how could we use everyday delivery of clinical practice and do sort of on the spot randomization by identifying eligible participants and randomizing them. So developing digital tools even to help with those aspects of study design. How do we go from the prototype to implement an evaluation and have embedded trials within real-world settings a little bit more agile and rapid? Adoption, of course, came up, and the need to really think about the contexts in which these tools are being developed, implemented, and tested. And then just the sharing of expertise for training, for having the IT personnel and infrastructure. So, if sharing programmers, database architects, software engineers, all those who have the knowledge needed in order to develop and understand the sustainability of these types of solutions. Ethics is evolving as technology is evolving, and understanding AI and the security that's needed and the data sharing that's needed for these projects to be done at a large scale, particularly if they're going to be done across institutions and different health regions. And just the knowledge mobilization. So one of the things that was striking in those 3 days is how much people didn't know about the work that's been going on in labs down the corridor or across campus. And so how do we have these communications a little bit more regularly, and also the governance and structuring and organization around that? So that's what came out of the McGill Day, and that really was a big push and motivation to apply for the FRQS network call. So this was in 2023. The FRQS was doing a revamp of looking at the networks that existed, and had a call to say, that they would start from scratch, that they would consider any new network, as well as possibly renewing existing networks. And so from the symposium, that was really an inspiration to go and apply for the digital health network, and say, if, doing this across McGill and harmonizing is really important, but if we could do it provincially, that's even stronger, where we can share potential solutions around advancing the training of the next generation of what's needed in terms of talent for digital health, but also resources, so existing data, infrastructure, and highly qualified professionals. This is the preliminary vision and mission that went in when we've put in the application for the FRQS Digital Health Network. This is just a starting point. We're likely will revise it as we work with the members over the coming months, and it's to mobilize the potential of digital technology in order to improve health, with the mission to build a very strong foundation of digital health science across Quebec and consolidate what is already strong across the province in terms of digital health practices and the skills across the different networks that already exist. The goal is to meet some of the unmet needs around not having a coordinated ecosystem around digital health initiatives. And we saw in COVID what the possibilities are if different research institutes work together, how we could really rapidly accelerate access to data and use of that data for meaningful decisions. But of course, with that, we also learned that the challenges of doing that. And so being able to share the tools, the resources in order to advance those kinds of capabilities of rapid use of data and rapid implementation of digital health tools. Address the idea of the scarcity of highly qualified personnel through training, but also of sharing those resources, moving away from the endless pilot project and difficulty in scaling digital health platforms to strengthening partnerships that would help to scale that up at a larger scale, and really starting to be able to generate evidence of the impact on outcomes. So a lot of digital health trials, either because they're not large enough or not sustained for long enough, it's harder to look at impact of outcomes at the mid and long term. So this is the drivers behind the Digital Health Network, with the idea that the network would really bring together the different larger disciplines around health, science, and technology, but also the social sciences, recognizing the important part of the human interaction and human design aspects of all of this, but also the societal impacts. And so one of the things that some of the experts and some of the team members in the Digital Health Network have expertise in is sustainable health. And I'll talk a little bit more about our transversal themes of taking digital health not only within the healthcare system, but out into the community and to address public health questions. The network, and I do apologize, this is sort of a French-English presentation, but I'll walk you through and we can come back if there are any questions. The four main axes of the network are everything around data platforms and access to data, quantitative methods, and artificial intelligence. And we were fortunate to be able to merge with the quantitative methods network in order to have the expertise of many of the biostatisticians and computer scientists that work around modeling. And then Axis 3 and 4 is moving towards the development of digital health tools, their implementation into the clinical practice, thinking of this more of a living lab, so having all of the key actors involved in selecting or developing digital technologies and thinking through how they would be implemented for spread and scale within the health system. And then finally, the fourth axis is really around digital health transformation. So working with organizations to look at this culture change that has to happen around adoption of digital health and addressing some of the concerns more around policy, and working with the Ministry of Health to see sort of what is more of the provincial vision and addressing some of the challenges around the rollout of different digital health tools. I'll talk about these transversal themes of equity, diversity, engagement when I go to our organogram here. So our team, the directorship includes representation of all of the main, of all of the universities from McGill. We have from University of Laval, University of Sherbrooke, and University of Montreal. the four axes that I mentioned before. So we have different members with expertise in each of these areas. And then our transversal themes are really around building capacity, training, where we have different members working on that, and many of them, and the idea is to consolidate what's already happening around training and bringing it to the network, knowledge mobilization, equity, diversity, and inclusion, citizen engagement, sustainable and fair access to digital health, sustainable health, and open science. So these are sort of our 10 transversal themes that we would like to consider throughout each of the axes of the network. I only have a couple of slides left. I won't get too much into the governance, but the main point here is that having student representation and having a active engagement of patient partners, which is a part of the comité de direction, will be really important, and we've integrated them across all of the committees, and having as well as an internal as well as an external advisory committee of leaders and pioneers in this area who could help guide the work of the network. Just to give you an idea of sort of some of the activities of what the network will be doing in the first year, which just started in April, what we'll be doing is a lot around just engagement of different members, developing our evaluation plan, what will be our indicators of success as a network, and then everything around knowledge mobilization, so that people know we exist, understand how they can get involved, and just putting the team in place and getting our charter in place. One of the things that the network really would like to do is to look at the excellent research that's being done across the province and bringing that together. So a lot of it is around making those resources available, having working tables with the ministry, with other policy makers in order to work together. And part of this came out of saying that rather than decisions be made independently, how could we bring the scientific community with the decision maker and policy community in order to work together early on, rather than roll out solutions and then realize that maybe those weren't the best choices. There might have been other optimal choices, but how could we systematically work together to identify sort of criteria of what's needed in order to select the best solutions, understand if they already are being developed by other groups, and then the implementation and evaluation of those, and what is likely needed in order for sustainability of some of the solutions. And then just the coordinated efforts of the research environment, so sharing training across all of our universities, where each have strengths in different areas of digital health training, and bringing the different groups together, the stakeholders that are working in digital health, through having regular events together and communication in order to help influence some of the policy and decision making that's happening provincially, but also federally. Some of the partners that we have within the network are at a federal level. And so these are the different partners that are participating with us so far. We expect the list to grow. Some of the platforms that exist that hopefully could be shared across different projects that are interested in digital health. And then, of course, the training across our institutions. We also have strong collaborations, and we've had discussions already with some of the existing FRQS networks and some of the ones that might not be continuing, but have excellent resources and assets that could be shared through the Digital Health Network. So if you're interested in becoming a member and following us more, you could go to this website, just scan the QR code, and it would be great if you would sign up. And in there, we just ask a little bit about your interest in digital health to understand sort of what our members look like, and where everyone might would like to participate as the network further develops. So these are some resources, but I'm going to stop there. And
thank you. Thank you so much. This was Dr. Sara Ahmed presenting to us. Really fantastic. First of all, congratulations on what you've accomplished so far, and on this position for leading this group at the FRQS. That's really putting McGill on the map. So I think that's fantastic. So thank you for that. The floor is open for questions. You can enter your questions in the chat. Just walk me through it. You're a researcher at the MUHC, and a company comes to you to do some sort of clinical trial in the digital health sector. Let's say something simple, a new SAP monitor that somebody wants to use. How does that work? Do we come to you? Do we go to the regular IRB? How would that work if you're working with industry that wants to test one of their digital technologies?
So I don't know if Dr. Forrester is on the line or Dr. David Buckridge, but I think if it's within the MUHC, there are a few different avenues. Definitely the Quebec network will be there to provide the tools and the resources to ask the right questions, to know, is it a good company to work with? What would be considered rigorous evaluation? So I don't know if you want to answer that, Alan. I think that's Alan. But I think this is where I'm saying that it's great that we have the Digital Health Innovation Officer, that role in the MUHC. I'll also mention CLIP. So I don't know if Jake Barlett is there, but he's played an important role in bringing in industry companies, providing them a space within the MUHC RI in order to further develop and test their solutions to meet the needs of a group. So I guess what I'm saying, the short answer is there are resources now available and people now available to help bridge that and work with the industry partner in order to, first of all, decide if they're the best partner, and think through safety requirements and so on. Are they approved by Health Canada, for example? And then think of a way of integrating them in clinical practice and hopefully making it a natural part of everyday, just way of doing things is to have an evaluation of a minimum set of indicators attached to that so we can learn from it. So I'm going to just stop there and see, does anybody want to add?
Alan, do you want to say a few words, Alan? You're on the line.
I'll do my best. My laryngitis is still pretty strong, but better than it was on Thursday, Sarah, when we spoke. I'll just say, yeah, your answer was right. Like, we do have the CLIP. The CLIP is a area where we can foster the interactions with industry. We do now have a process, an intake process to support. We're building out a contracting process to make that easy. I think the bigger challenge is going to be, and it depends a little bit on some things that are going to happen in the next few years, like with Epic, is what is the cost of integrating new tools into the platform where those tools may not be seen as mission critical, and how do we support that financially? Is it the company that pays for that? Is it some other form of grant? If industry doesn't see a pathway to commercialization, then they're not going to be that keen on funding. So I think it really comes down to money in the end of the day. And so we're going to have to work on how do we create avenues for investment so that companies can do the work in our setting, in an environment which is, somewhat cash strapped from time to time.
Fair enough. Thank you. Thank you, Alan. Sasha, you want to unmute and ask your question?
Sure. So that was such a great presentation, as always, Sarah. But it's kind of like Nadia's question, because there are people. So I had somebody, come up to me because I'm an epidemiologist, and they're a researcher who doesn't do much translation normally, but they have this innovation that they think needs to get to be used at the MUHC or maybe province-wide or maybe national-wide. So they were like, oh, you know how to do all that stuff. And of course I don't. But in talking to this person, because I think there's probably lots of people who have an idea about an innovation. So like, how soon should they contact you? And what if, because this person's concept, they think that it's ready to go, but it has to be evaluated. Like Alan said, it has to be so it has to be evaluated to make sure that it actually works the way this person thinks it will. And it has to be something that the province would pay for ultimately, right? Like Alan said. So you guys, as I understand, you guys have people maybe that this person could connect with, or other people like it, at an early stage to advise this person. But there's also the idea that this person will have to find maybe a partner or somebody that could bring money to help this person evaluate their tool. Yeah.
So I don't, you're asking me first, right, Sasha, or Alan first? Okay. And then Alan looks like he has an answer, so he's going to solve it all for you. But absolutely, day one, and that's part of what I'm hoping the network will solve is how do you do this? So I sort of, when we started building in 2017, we sort of pedaled our way through things. But things like starting early, is that does the technology respond to the need? Does it need to be tweaked, adapted, or is it just not worth going down? So the value added is not worth the effort needed. And doing market comparison, what else is out there, that might be a better option, because, everybody sells you bells and whistles, but if you really need to do that comparative analysis, making an early business case to the provincial government is really key. We learned that, even though our programs were really invested, they gave the time of their clinicians to be involved in the co-creation, working with the provincial partners early on, day one. Everyone has input in how and what is implemented is really key. So yes, the network won't do that work, but the network will definitely provide the supports needed to go and organize in the right way to start off on a likely successful foot to get started and continue and do the implementation. I really want to emphasize the knowledge mobilization network. We made sure to network transversal theme. We made sure to get really strong scientists in implementation science, Aliki Thomas and Tatiana. I won't even attempt to say her last name, but to provide that support for the early implementation. What indicators do you need to assess from day one? And that's another reason why starting early is really important. Alan?
I'll add just a bit to say, I think we need to separate out a little bit about the business growth and the market from evaluation of the health technology. But on the same token, you can't really separate them out completely, because ultimately, if you're trying to create a product that's going to have an impact, if money's not coming into you somehow, either because of the promise of future revenue or because of current revenue, that business goes out of business. It runs out of cash pretty quickly. And so, it does have to go a bit hand in glove a bit. That being said, you do often get into problems because of conflicts of interest that we just need to, as a researcher, I think people get very concerned about. And we just have to make sure that gets managed closely.
Thanks, Alan and Sarah. Louise, do you want to just unmute and tell us about the RI-MUHC Digital Health Hub?
Yes, sure. Thanks for a great talk, Sarah. This has been a long road, and I think, there's kind of three things happening at the same time, which is also excellent. So there's the Digital Health Hub at the RI-MUHC, which is actually, as of today, is led by David Buckridge. And this is really to be a hub where people interested in developing and also evaluating. Sarah put a lot of emphasis on the fact that there's a lot of digital health tools out there that have not yet been evaluated. And for them to be implemented, be it in our healthcare system at the MUHC or province-wide, require excellent evaluation. And then, later on also can lead to better commercialization. So that's kind of the idea of the hub. And then Sarah obviously being at the RI-MUHC will be part of this hub and anyone else who's interested, but David will be forming that. It just started today. And then, this is great that at the MUHC, there's now the pole for innovation. So I presume that some of the innovation that will be, as Alan said, potentially evaluated for incorporation in our healthcare system already exists. And then there's going to be a question about business plan and all that. And then, but what will be developed by our researchers and evaluated event obviously will be also, tested within the MUHC and hopefully eventually be implemented as well in the MUHC. And then, with Sara leading the Quebec-wide network, obviously we will make use of all these resources and then interact with our partners to build this area, both, at the MUHC and then Quebec-wise. So I think it's a great combination of event happening, and we need to see how we can make it work, most effectively and, to the benefit of our population.
Alan?
Can I add to Louise's point that we can't forget her contribution as well?
Oh.
Like her building out the CIM and really focusing on building a clinical trials infrastructure really goes a long way to making a huge, to making all of this possible. So Louise, I know it's very kind of you to mention all of our names, but what you're doing is amazing as well. So, and it's going to help a lot.
So I just want to be clear for everyone on the line. So if there's a researcher that wants to do an investigator-initiated project, that is a digital health project, who do they contact versus if there's an industry that comes to you and wants to do a digital health project? So these are two different, one is industry, one is the investigator. I just want to be clear for everyone on the line. Who is the contact? How does the investigator, is it through the RI? Is it through this digital health hub? Is that the contact, that the way, the trajectory?
Maybe I can start with that. Alan, you can complement. Obviously all these resources have the same goal and will work together. The point of entry from a researcher point of view, is the RI, and, the réseau will help, identify partners, collaborators for the investigation. And then when it comes to deciding, which device, should be used at the MUHC, and also there's a clip. It depends also the type of device that is being, developed or tested. It would be a decision of the MUHC Innovation Center, that will decide, what is being tested or implemented within the healthcare system. But it is a good question. This is something that, as we're starting the digital health hub today, and then Alan and his group is also, at the beginning, it's something that needs to be clarified for everyone. So it's a good question, and we'll make sure that this is clarified as we go along. But this is how I see it personally, but, we will make sure it's clear to everyone.
Okay, thank you. Stephen, do you want to unmute?
Yeah, I think I think the advice and the suggestions and the thoughtfulness of the comments that people are making are great. But I have to tell you, from my own experience at the MUHC over the last 30, 40 years, I think looking to the institution, whether it's the RI or the hospital or even the faculty for that matter, will end up proving disappointing to most investigators. And I think the clinicians in the group, quite frankly, need to look to their own clinical practice and ask, where's the opportunity that's occurring in clinical medicine in my area of expertise, and reach out to those groups with a win-win solution, something that is of interest to you, that's going to move your research forward, but you also have to think of, all right, why should they fund me? Why should they give me any money to do this? But there, Sasha asked the question, and frankly, on the biologics and rheumatology, there's so much going on there. I don't think you have to look any further than that. The other way to have industry come to us, we found in the past, was to put together a good summer course where you both showcased the things that the group was doing, but also helped industry. There's people in industry who want to improve their skills. And providing that education for them is a great way to make the connection. And I think just starting small with those two things makes things a lot easier. One of the big problems with all the entities that have commented today is everybody's looking at the profit side of the story, but that's a really tough, that's a really tough journey for academics to protect, come up with the patent protection, all the IT stuff, and think ahead to one day, how are we going to make money for the institution? I think as academics and as clinicians, our first and foremost obligation is to come up with something innovative, have a lived-in lab where we can test it, and then try and find partners who will help us scale it up whenever possible. And if you just manage that, I think you're way ahead of the curve.
Thank you, Stephen.
Just quickly, I think that is right on. I think a lot of what you said is absolutely, it has to, I think if you look in clinical practice and say, what do I need and who can help me get there? It's much stronger than waiting to, look broadly for an industry partner. I'm even at one step earlier than that, Stephen, is even if an industry partner comes and approaches me and I invest the time and effort, is it worth it? Are they going to be around in a month from now? Are they going to be around in a year? Like even just assessing some of these basic things, I think will be really helpful with all the Wild West sort of and so many technologies that exist out there. But absolutely, starting small, breaking up into pieces is definitely the way to go.
Sara, where's this living lab that we're talking about?
So when I refer to a living lab, like Stephen said, it's your clinical practice, right? So for me, it's the rehabilitation programs that I work with where we literally go sit in the space where they're delivering care and work together and sort of observe and plan together. And it's not done in these sort of bouts of, research, which is like, let's talk now and then let's talk a month from now and 6 months. It's really iteratively saying what are the issues, meeting regularly, and allowing to embed researchers within a lab, and industry partners might even come. So I had Physiotech on the screen. They provide part of a solution. They might actually come and sit with us in the clinical setting. So when I refer to a living lab, it's the space where you want to affect the change.
Approval for the living lab?
No, so MUHC probably wants to put around some rules and ways of working around that. Most settings do, but it's more of a cultural transformation, I would say, than permission. It usually comes from the clinical team, the managers agreeing to work this way because it means you're being a bit disruptive and doing things a bit differently. So it's just so for example, in the settings I'm in, it's just culturally accepted that we're going to work that way. And it, like Stephen said, it starts with an interested group who really wants to make a change, and they just invite everyone in to work together.
Okay. Any final words, Alan? We have 1 minute left.
I really like the concept of the living lab and the learning health system. I think it's something that's very important. It comes from a cultural, as Sara mentioned, it's a cultural change at the level of the units often, but does require senior level leadership. It often involves accessing data or interactions with partnerships. So there does require some process to ensure that those two things happen in a consistent approach. But ultimately, it comes down to the clinicians and the managers in particular areas being focused on trying to improve the quality of care that their patients are getting, and not being satisfied with the status quo. So I'll just leave it at that.
I'll just add one small comment. I know we have to end, but I would just add that industry usually recognizes when there is that cultural shift in a setting, and if they're at a very early TRL technology level and they want to advance it, they're naturally attracted to sites where they perceive them as functioning as a living lab, where they'll be welcome in if they meet the criteria. So just to say that it helps.
Fantastic. Well, thank you so much. It's 1 o'clock. We'll have to stop the rounds there. Thanks very much, Dr. Sara Ahmed, for the fantastic presentation. Really, really helpful. Dr. Alan Forster for your input as well, and the other people who've actually helped us with that provided great discussion. So thanks, everyone. I wish everyone a wonderful afternoon and look forward to seeing this program grow and maybe see you back here next year, Sarah. Thank you.
Thank you. Take care.
Bye-bye.
Thank you. Bye.
Take care. Thank you. Bye.